There are two medical plan options available at Iredell County: the Open Access Plan, or sometimes called PPO, and the High Deductible Plan with HSA. Both plans are offered through Cigna. Let's review the highlights of these plans to assist you in your decision of which plan is right for you. Let's start with Cigna's Open Access Plus plan. This is a traditional plan with a copay deductible coinsurance structure. So when you go to your primary care provider, you simply pay the copay each visit. The specialist visit is subject to the deductible. If you need to see a specialist, visit to the emergency room, or have a major procedure like surgery, you would have to meet your deductible, and then you would be responsible for 30% of the remaining cost until you meet your out-of-pocket maximum. Copays will apply to the out-of-pocket maximum, but this excludes prescription copays. The coinsurance is 30%, 70%. Your prescriptions are covered under a copay schedule after a $150 individual or $300 family deductible. More information on prescriptions will be covered later. To save money on healthcare expenses, you could use a flexible spending account, or FSA, to set aside pre-tax dollars for medical costs. Now let's review the high deductible plan. The high deductible plan has no copays. Rather, you pay the negotiated rate for each doctor visit and procedure, except for preventive care, which is covered in full until you reach your deductible. Once you reach your deductible, you will be responsible for 30% of the cost until you reach your out-of-pocket maximum. The coinsurance is 30/70. Prescriptions fall under this structure as well. Simply pay the negotiated cost of the prescription until you meet your deductible, then pay 30%. Costs for healthcare and prescriptions all contribute toward one deductible and out-of-pocket maximum. The high deductible plan is paired with a health savings account, or HSA, to use for your medical costs. If you participate in the high deductible plan, the county will contribute $750 to your HSA. The $750 will be prorated based off your benefits effective date. The health savings account is administered by the State Employees Credit Union. Let's go over the plans again side by side. Under both plans, preventive care is covered in full at 100%. For the Open Access Plan, you have a copay deductible coinsurance structure. With the high deductible plan, you pay the cost until you meet your deductible, then you pay 30%. With the Open Access Plan, your copays, except prescriptions, will go toward your out-of-pocket maximum. On the high deductible plan, all paid costs are applied to your out-of-pocket max. The Open Access Plan deductible is $2,000 for individual coverage and $4,000 for family coverage, plus prescription deductible of $150 for individual and $300 for family. For the high deductible plan, the deductible is $2,000 for individual and $3,500 for family. The total out-of-pocket for the Open Access Plan is $5,000 for individual and $10,000 for family, while the out-of-pocket for the high deductible plan is $4,000 for individual and $5,500 for family. Remember, on the high deductible plan, your deductible counts towards your out-of-pocket maximum, unlike the OAP plan. The Open Access Plan is paired with a flexible spending account to set aside pre-tax dollars to use on medical expenses. The high deductible plan is paired with a health savings account. Remember, if you are enrolled in the high deductible plan, the county will deposit $750 into your HSA. You do not get this contribution if you are enrolled in the Open Access Plan.